Hi, I'm Dr. Corinne Knight, and this is Jim Aaron. We are our colleagues at Advantage Physical Therapy. And in light of the Olympics and all the little round polka dots on Michael Phelps's back, we wanted to talk a little bit today about cupping. I wanted to show you some of the tools and tricks that we use. Let's start with what cupping is. Physical therapists use cupping as a myofascial release technique, and what that means is when you have soft tissue that is tight and restricted and it limits your range of motion, we utilize cupping to really remove the adhesions or any type of restricted things that may be causing pain or discomfort as you move. Michael Phelps seems to be using it more for a trigger point release, and we'll show you that. We're also going to show you another way we do it in terms of just to release that pain. Now, the bruising you see, that is what comes with cupping. It does make you not only sore, but a little bit bruised. And Jim has been kind enough to be our subject today. So these are some of the devices you use. This right here is used for the actual suction. I don't know if you can hear that. We're just going to rest that right there. And then you also get cups in different sizes. That allows you to really work on different areas of the body. Sometimes you need small cups. For instance, for incisions, you're going to want a little bit more of a smaller cup. But for areas broader, for instance, such as the back, you're going to want a larger cup. So we're going to start with the large cup. And Amanda, who's recording, is going to get a little closer. You just kind of add this right here to the suction right there. And it is an aggressive technique, so it's going to be uncomfortable. But what I like best about this technique is you feel a difference immediately. So you just kind of put it, Jim's got some classic trigger points from being at the desk all day, right in the areas of where you're tender, and you just apply the suction. Now, the ancient Chinese medicine and the way you do it traditionally is you actually use glass cups. Those that are certified in it, I am not, will actually light a flame underneath the cup. It'll suck out all the oxygen and you'll get that nice suction there. I don't want to use any open flames. So I use this little tool right here and you leave it. It varies upon the practitioner as how long you leave it. I'll leave it for probably about 60 seconds if I'm going to do a trigger point area. Jim, you don't really feel any pain right now, right? Just a pulling. Mm-hmm. So you just leave it there. Now, just to release it, we typically grab the top and it relieves immediately. You can see the redness here. Some people bruise immediately. Jim's a tough guy, so he's not going to bruise immediately. But let's go ahead and see how he reacts to the next technique. So the next technique you can do is you don't apply as much suction, just probably about 50% of that, and then you pull. And the pulling there, you can hear him. You can already feel is very tight. He's not going to bruise too much today, which is good, unfortunately. He might want to look like Michael Phelps, but that's not going to happen. We're just going to keep pulling. And yes, it's aggressive, and yes, it's uncomfortable, but like I said, immediate results. So if you're interested in cupping, if you're interested in looking like an Olympian, you can go ahead and find us here at Advantage Physical Therapy. Thank you.